So it is the formation of calculi in any part of the urinary tract. That is your urolithiasis. So we'll see what are the predisposing factors in case of urolithiasis. These are very important topic, predisposing factors. Predisposing factors. One factor was asked in 2019 veterinary science. First is, if you look at the species where you find more cases of urolithiasis, you can find more cases in male goat, then male buffalo calf, then male cattle calf. Then, not very important, dog, cat. So these are the species. The most important second point is deficiency of vitamin A. And along with this, you remember administration of estrogen compound. Previously, they were using stilbestrol as a growth promoter. So these two, one is deficiency of A. Vitamin A is necessary for the health of epithelial cell. It is necessary. So deficiency of vitamin A or excess administration of estrogen, both things they lead to the desquamation, that is removal, degeneration of the epithelial cells. Which epithelial cells? These are the epithelial cells of your nephron. These are the epithelial cells of your nephrons. So if these cells degenerate, this is the nephron. These epithelial cells, if they degenerate, desquamate, then these epithelial cells, they may act as a nidus, a point, act as a nidus, like this. So around this, your uric acid may be urate or ammonium, PO4-3 phosphate, magnesium, this struvoid, this may get deposit. That may lead to the formation of crystal and that may precipitate. So these epithelial cells, wherever they are present, like in nephrons, they are present in urinary bladder, so they will desquamate because of deficiency of vitamin A or administration of estrogen. And they favor the deposition of salt. The third point is imbalance of calcium phosphorus ratio. Normally, should have this calcium phosphorus ratio in 1.2:1. If phosphorus increases, calcium decreases in the feed itself, that may lead to formation of phosphate calculi, or maybe some hormonal imbalance that may disturb the calcium phosphorus ratio. For example, it is 2:1 in the blood. If this ratio disturbs, it may lead to deposition of the phosphate calculi, precipitation. Then the fourth factor is feed itself. Which feed? High concentrate like grains. They are rich in phosphorus. So that may lead to precipitation of phosphate calculi and high concentrate and low roughages. Low roughages. They also contribute. Next is season. Next is season is also important. What kind of season? Your peak winter and peak summer. In case of peak winter, there is less water consumption by the animal. In case of peak winter, in peak summer, there is loss of water. Loss of water. Of buffalo calf and your male goat, maximum number of cases come with the urolithiasis. In case of peak winters, there is less availability of the green grasses or green fodder in case of peak winter. That may also lead to less vitamin A in the feed, and that may be desquamation of the epithelial cells. Then age. Age of castration, very, very important. Castration means removal of testosterone hormone from the body. This hormone, this is the normal urethra patency. A male urethra, it is narrow. It is narrow. But if you remove your testosterone hormone by castration, it will become further narrow. It will become further narrow. So normally this patency, this diameter, the maintenance of this diameter is the role of the testosterone hormone, your male hormones. So the age of castration in case of male goat, it is 6 months. 6 months or after 6 months, go for male goat or buffalo calf castration. That is after 6 months. Before 6 months, if you do castration, means you are removing testosterone, the urethra will become further narrow and calculi may deposit and they may cause obstructive urolithiasis. So age of castration is very important. Then urinary tract infection. Urinary tract infection are more in female as compared to male. These urinary tract infection are your bacterial infection. Which bacteria? Proteus, staphylococcal, E. coli. This Proteus bacteria, if it is present, it will secrete one enzyme urease. The role of urease is to break down urea into ammonia. That will make urine pH alkaline. And in this alkaline pH, the stone form, they are struvite. They are struvite. So struvites are the most common calculi in case of dog, which are formed in alkaline pH, and this alkaline pH is created because of the bacterial infection Proteus staphylococcal. But in case of herbivore, your cattle, and they have alkaline pH of their urine. So in that case, True white are also common. So in this case, the dog is having acidic urine, but this acidic urine is made into alkaline with the help of this urease enzyme of the bacteria, and the pH become alkaline. True white calculi are formed in this pH. So, if pH is more than 7, that is alkaline. Which stones are precipitated in alkaline pH? Which are found? They are true white. They are calcium carbonate. If pH is less than 7, that is acidic. Then which crystal or calculi are precipitated? They are oxalate. They are silicate. pH acidic or alkaline. The chemical name of this true white is magnesium ammonium phosphate hexahydrate. Hexahydrate. That is uh, the chemical name is very important. This is ammonium, magnesium, phosphate is PO4 3. This 3 is very important. Magnesium, ammonium phosphate dot 6 water hexahydrate. This is the chemical name of your true white. And the structure of this true white is coffin lid structure. This is the coffin which is in which the dead body of human being they are placed before going to the church and all. So this coffin lid like structure is for your true white. And these are ammonium, magnesium, phosphate, PO4 3 is important. This three trivalent form is important. This is trivalent. That is important. So coffin lid structure, and these are some of the predisposing factors for urolithiasis. So if I summarize the predisposing factors, then your vitamin A deficiency, estrogen administration, then age of castration, that is very important, and season, peak winter, peak summer, and feed high concentrate, that is your grains, your wheat bran, your wheat bran, which is rich in phosphorus and low roughages. After is male goat, then buffalo calf. These two are very, very important. Then pH, alkaline or acidic, and at the end urinary tract infection UTI, that are UTI more common in female than as compared to male. And alkaline you true white, calcium carbonate, and acidic are oxalate and your silica. So these are the some of the predisposing factors which lead to deposition of the calculi from in the urinary bladder. In which species This is more common in case of bladder. It is in horse. In which species this sigmoid flexure here it is common? Your ruminant, bullock. Which species behind if it is os penis? Behind the os penis? Dog. Which species at the tip urethral process? It is ram. So from one diagram, you can easily remember the site of the calculi. So as I explained, if we make it like sigmoid, then this, if we make it as os penis, just to understand for dog, and this is the tip and it is the urethral process UP for. So the most common calculi in the bladder, mostly neck of the bladder, you will find horses, and distal to sigmoid flexure, you will find in case of bullock. Distal to here at this area, distal to os penis at this area in case of dog. Then this urethral process in case of ram, in case of lamb, that is male sheep, and here cat, in case of cat around this urethral orifice, and at this tip you will find in case of buffalo bull. So in case of buffalo bull, at the tip of the penis and distal to caudal to sigmoid flexure, both are equally important. But in case of cattle bull, caudal to sigmoid flexure. In case of dog, caudal to, this is os penis, so caudal to os penis in dog. In case of ram and your sheep, it is urethral process, base of the urethral process. Tip is so narrow, it will stick here only at the base. And in case of cat, it is urethral process, penile urethra near the orifice. So this is about cat and the neck of the bladder, or simply cystic calculi in case of horses. So this is one diagram to explain all the species.